Cranial nerves examination. As you know, you have 12 cranial nerves, starting with the first, second, third, fourth, fifth, and etc. The first cranial nerve is olfactory nerve. How we examine cranial nerve, starting by examination of olfactory nerve. Before starting examining the olfactory nerve, we have to exclude the non-neurological causes of loss of smell, anosmia, because the commonest cause of loss of smell sense were due to non-neurological. For example, patients with common cold, influenza, any nasal problems, you may have loss of smell, and usually those patients have bilateral loss of smell, which is not significant neurologically. So we have to exclude the non-neurological causes of loss of smell. Number 2, you have to examining each nostril separately، يعني نسد فتحة من الخشم ويشتم من الفتحة الثانية. You have to examine each nostril separately مثل ما راح نشوف بالصورة using a non-irritant substances, for example tobacco or coffee. So you have to use non-irritant substances for performing the test. We have to, what is important is perception of smell, not to differentiate the type of smell. أهم شيء إنه عنده perception of smell. And unilateral impairment of smell have a neurological significance. So if the patient have unilateral loss of smell, this is very significant neurologically. You may have frontal lobe lesion, for example, and bilateral impairment of smell have no neurological significance. مثل ما قلنا عادة non-neurological causes of loss of smell يصير عندنا bilateral loss of smell, which is not significant. This is the way to examining for the olfactory nerve by obstructing one nostril and smell from the other nostril separately. Should be done bilaterally. After we finish examination of the first cranial nerve, you have to go to the second cranial nerve, which is the optic nerve. Optic nerve, very significant. Optic nerve. And as we know, the optic nerve, this is one of the part of the brain which can be visualized by a naked eye appearance. نقدر نشوفه هنا part of the brain by fundoscopy examination. This is the optic nerve, and this is the retina. The retinal vessels, very important during fundoscopy examination. This is the lens and the cornea and the iris. To start examination of the patient regarding the second cranial nerve, we have to examine the color vision, number 1. Then you have to examine the visual acuity. Then you have to examine the visual field, the peripheral field, the central field, and looking for the blind spot. And finally, we have to do fundoscopic examination of the patient. These are the 4 steps in examination of the second cranial nerve. So I have to start with the examination for the color vision, so he can recognize these numbers. If he has a color blindness, for example, there's difficulty in recognize the numbers from this test. Then you have to go to the examination of the visual acuity, وهذا تعرفوا chart طبعا بنقول patients and the visual perfect visual acuity حتى يشوف هنا الفتحات مثلا upward downward، أو يشوف هنا الأحرف. طبعا قاعدة على مسافة 6 أمتار on 6 meters، ونقول مرات هذا ال perfect مثلا visual acuity عند 6/6 or 6/9. And this is the way to examining for the visual acuity. Visual acuity, you have to examine each eye separately. You have to examine each eye separately and examining for the visual acuity. Then the third steps in examination of the cranial nerve هو examination for visual field. Examination for visual field refers to the total area. What's the meaning of visual field? The total area in which object can be seen inside. Peripheral vision as you focus your eyes on the central point. فعندنا هنا طبعا يعني device or machine بالشعبة العيون يقدر يقيسون يسموها المساحة البصرية. شوف الفيجوال field visual field وراح نشوف هنا إذا عنده defect in visual field or normal visual field ونشوف أيضا ال blind spot the way المطلوب من عندكم in the your clinical practice in the world هو examination of the visual field by what we call the confrontation test توقف قدام البيشنس على مسافة متر وتسد العين المقابلة وحده هو أيضا هم يسد عينه وتحرك انت أصابعك وتشوفه هو راح يشوف الأصابع أو ما يشوف حركة الأصابع هذا نسميه confrontation test this is a visual field examination. Then after we finish visual field examination we have to examine the fundoscopy والفندوسكوبي مثل ما قلنا very important الفندوسكوبي لأنه راح نقدر نشوف بالفندوسكوبي examination راح نقدر نشوف الريتنا ونشوف retinal vessels very important طبعا in patient for diabetic retinopathy مثلا for example it's very important to examine the patient eye مثلا examination of patients with hypertension looking for hypertensive retinopathy or مثلا examination of the optic disc for example if the patient have optic atrophy or he has papilledema يعني optic disc swelling and etc. So fundoscopy examination is part of examination of the second cranial nerve starting color vision, visual acuity, visual field and fundoscopy examination. The most important examination of the cranial nerve هو حقيقة third, fourth and sixth cranial nerve, the oculomotor, the trochlear and abducent nerve. Because those cranial nerves supply the extraocular muscles. احنا تعرفون extraocular muscles عندنا superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique يعني وعندنا أيضا levator palpebris superioris. هاي المسلز اللي هي extraocular muscles responsible for the movement of the eye during vision. To start examining for oculomotor nerve, trochlear and abducent, we have to inspection in a neutral position. نشوف inspection of both eyes, looking for ptosis and the proptosis and the sequent and the inequality of the pupil. إذا راح نشوف احنا الeye إذا عنده ptosis, proptosis أو عنده sequent أو نشوف البيوبل إذا عنده مثلا dilated pupil for example, looking for the dilatation of the pupil. Number 2, examining for diplopia مثلا عنده diplopia or and then nystagmus or limitation of eye movement. Number 3, doing the light reflex. This is part of the third, fourth and sixth cranial nerve examination. Light reflex اللي هو direct light reflex and consensual light reflex. Doing the accommodation طبعا direct light reflex راح نشوف constriction of the pupil during applying light معناتها هذا third cranial nerve is perfect they يشتغل supply the pupil with consensual looking on the other side and doing the accommodation reflex ونخلي فد object in front of the patient then you have to يعني نقرب هذا الأوبجكت باتجاه عينه وراح نشوف شو راح يصير عندنا 3 أشياء. هذا هو الأكوموديشن ريفلكشن هي 3 أشياء راح يصير عندنا ptosis راح يصير عندنا meiosis يعني constriction of the pupil وراح يصير عندنا convergent sequent. فإذا صار عندنا ptosis meiosis convergent sequent معناته الaccommodation reflex is perfect ما عنده مشكلة. الثird cranial nerve palsy من عندنا third cranial nerve palsy أو injury to the third cranial nerve ويشوفوا هاي بردها مرات third oculomotor nerve palsy third cranial nerve palsy خاصة in diabetic patient راح نشوف يصير عندهم partial or complete ptosis usually partial ptosis with downwards and outwards displacement of the eye والpupil dilated إذا من عندنا oculomotor nerve palsy راح نشوف ptosis downward and outward. ليش outward؟ لأنه اشتغلت عندنا lateral rectus supplied by the abducent trochlear superior oblique dilated pupil and fixed with loss of accommodation reflex is lost طبعا partial or complete. فالاوكيلوموتر نيرف بالسي لانه الاوكيلوموتر سبلايد شي يجهز الاوكيلوموتر سبلايد the levator palpebral superioris, supply the medial rectus, supply the superior rectus, inferior rectus and inferior oblique and levator palpebral superioris and the pupil. فإذا 5 muscles supplied by the oculomotor nerve. فمن عندنا oculomotor nerve pulse هاي 5 muscles كلها ما تشتغل ويصير عندنا dilated pupil. The fourth cranial nerve supplied the superior oblique. فمن عندنا fourth cranial nerve palsy or injury راح يصير عندنا impaired downward movement خاصة من يصعد درج very difficult. sixth cranial nerve من يصير عندنا sixth cranial nerve palsy طبعا شايفين هواي sixth cranial nerve palsy لأنه long course of the nerve inside the brain, long course. A sixth cranial nerve has a long course liable to get injury, especially in diabetes or in stroke or CVA or any brain problems. So when we have a sixth cranial nerve palsy, the patient have inability to move the eye outwards. Sixth cranial nerve supply the lateral rectus. Fourth cranial nerve supplied the superior oblique and the rest والخمسة البقر supplied by the oculomotor nerve. The examination of the third, fourth and sixth cranial nerve طبعا هما originated from the midbrain oculomotor, trochlear from the midbrain, abducent originated from the pons. This is the way. These are the extraocular muscles and this is the way. نخلي فد object ونشوف movement of the eye upwards, downwards, left and right. ونشوف إذا any defect in the movement of the eye. This is a patient got third nerve palsy, very clear. شوف الآية شوي رايحة laterally لأن جرتها lateral rectus and there is ptosis and there is dilatation of the pupil. So ptosis, eye down and out, dilated pupil which is not responsive to light and accommodation. This is the fourth cranial nerve palsy يعني superior oblique ما تشتغل, double vision going downstairs طبعا double vision going downstairs or reading books طبعا very difficult. Ask patient to turn the eye in and then to look down may cause vertical hypertrophy يصير عندهم. طبعا شلون نفحص السوبيريور اوبليك انه نقول له باوع على خشمك. Ask the patient to look down and medially. This is sixth cranial nerve palsy very clear انه العين ما راح تجي هنا شوف هاي شلون جاية ما تجي لان lateral rectus ما يشتغل. Failure of lateral movement